In this video, we will be showing you how to take a dental impression on your patient. First, you will gather supplies including your mixing bowl, spatula, wax strip, wax square, 2 alginate packs, trays, and scissors. You will then size the trays on your patient, ensuring that the tray can fit in their mouth and extends far enough back to cover all the necessary anatomy. Once you have found the appropriate trays, you will add the wax strip to the posterior portion of the tray for patient comfort, as well as adding space to the tray to capture a patient's third molars. You will then begin mixing your alginate for your mandibular impression. Take 1 packet of alginate and hit against your leg. This is done to begin activating the powder. Making sure all the powder is in the bottom half of the packet, cut the packet at the dotted line. Pour the powder in your mixing bowl. Take the empty portion of the packet and fill with cold water. While holding the mixing bowl from the bottom with one hand, take your spatula and begin to mix. You want to press the material on the sides of the bowl while mixing to get rid of any air bubbles. Do not spend too much time on these steps because the alginate begins to set as soon as you mix with water. Once your material is completely mixed and is a frosting-like consistency, use the spatula to load the mandibular tray from the anterior portion first. Then, wet your finger to smooth the surface using cold water. Insert the tray into the patient's mouth in a sideways orientation and then move it to match the arch. Seat the posterior portion of the tray over the teeth and then press forward, pulling the lips over the front of the tray once you have set the impression over the arch. Keep your fingers over the top of the tray, checking for the material to set. You will know the material has set once it feels somewhat rubbery. Use one finger to hook under one side of the tray and pull away from the arch to release suction. You can then remove the tray from the patient's mouth by again turning the tray sideways as you pull the tray out. Now you can repeat the steps for mixing the alginate for the maxillary tray. Insert the tray into the patient's mouth the same way you did for the opposite arch. Ending with pulling the lips over the tray. Once the material has set, use one finger to hook under one side of the tray and pull away from the arch to release suction. You can then remove the tray from the patient's mouth by turning the tray sideways as you pull the tray out. You will now sterilize the impressions before taking them to the lab. Gather some paper towels and a bottle of sterilizing solution. Rinse the impression under water to remove any possible blood or food debris. Then spray the impression with the solution. Wet the paper towels and wrap the impressions to prevent the impressions from drying out. The last step is to get an impression of the patient's bite using the wax square. Hold the square to the patient's mouth to check for size. Remove any excess wax. You will then run the wax under warm water. You will then insert the wax square into the patient's mouth and have them bite normally into the wax for about 5 seconds. Remove the wax and keep with the impressions.